performing a skin assessment. So when assessing someone's skin, you want to inspect every inch of their skin. You're going to want to do this by visually inspecting, so you're going to want to remove items, have them lift up their arms, their legs, you're going to want to remove their socks, and you're going to want to look at any dressings that they may have to make sure that those are clean. So with these assessments, when you're performing them, you're typically performing a skin assessment simultaneously when you're performing other body assessments. So the first thing I'm going to do is I'm going to gather my supplies, and I am going to also grab a measuring tape. And so I'm going to introduce myself, and then I'm going to perform hand hygiene. So, hi, my name's Megan. I'm going to be your nurse today.
Hi, Megan.
What's your name?
My name's Stephanie.
Okay, so I'm going to be performing a skin assessment on you.
Okay.
So first I'm going to perform hand hygiene. And then I'm going to want to inspect skin. So I'm going to want to look at the color of their skin to make sure that it is consistent with their ethnicity. I'm going to look for abnormal findings such as jaundice, cyanosis, pallor, erythema, and if they're darker skinned, I'm going to want to look at their sclera, their lips, and their nail beds. I'm then going to want to assess for moisture, and I'm going to do this by looking at their lips and having them open up their mouth to make sure that they have an adequate amount of moisture, and I'm also going to be looking for diaphoresis. The next thing I'm going to do is I'm going to look for any wounds or lesions, and I do this by looking at color, drainage, where the wound is, what type of wound, the length, depth, if there's any tunneling, if it's raised, the texture, and the location of their wounds. Then I'm going to move into the pressure areas. I'm going to want to look at the back of the head, the hips, the sacrum, and any other bony prominences such as elbows, heels, ankle bones. And then I'm going to look for hair growth. So I want to look at where hair growth should and shouldn't be. And the next thing I'm going to do is I'm going to move into palpation. So with any edema, which is fluid accumulation under the skin, I'm going to want to press my finger down on it, as an example, down, and then lift up. If my imprint stays, then that means that there's pitting. So then I'm going to want to look at the location and then the severity of the pitting that's happening. And then I can also take circumference measurements if that's necessary. I'm also going to want to look at the temperature, and I do this by using the back of my hand to assess if certain spots are hotter. And then I'm going to want to look at the turgor. And I do this by grabbing the arm and assessing the forearm, and going to want to pinch the skin and then release. And it should be immediate, and if it's not, that means that your patient is dehydrated. So next thing I'm going to want to do is inspect the nails. I'm going to look at the color. I'm going to look for pink, blue. I'm going to look to see what their capillary refill is, which should be within 3 seconds. I'm also going to look at the shape. I'm going to look for clubbing or any type of scooping. And I'm also going to want to look at the texture. Are they brittle? Is my patient a nail biter? Are they sore to touch? Are they bleeding? I'm then going to move into the hair. So when I inspect the hair should be shiny, and I want to make sure there's no odors, I want to make sure there's no infestations, and you can tell a lot by someone's hair with their personal hygiene. So you're going to part the hair in multiple parts and look just to make sure, and all is clear. I then am going to move into my head, face, and neck assessment. I'm going to focus on symmetry during my inspection. So slight deviations are normal, and so what I'm going to do is I'm going to again gather my supplies and perform hand hygiene. I would introduce myself again, and starting with the head, I'm going to want to inspect to make sure that my patient has symmetry with various faces. So can I have you smile, frown, stick your tongue out, move it side to side, okay? And then I'm also going to want to look at the shape of their head to make sure that it is not abnormally large. And I'm going to, along with facial symmetry, look at their eyes, their nose, their mouth, to make sure everything is where it should be. And I want to make sure that they don't have any twitches. And so I'm going to then palpate their scalp to check for any lumps or abnormalities, and everything's good. I then am going to move into the neck, which I'm going to inspect symmetry, swelling, masses, and I also want to make sure that their trachea is midline. So the first thing I'm going to do is do range of motion. So can I have you look up, down, side, other side, shoulders up, shoulders down. And I can also then palpate to see that the trachea is in midline. And the next thing I'm going to do is I'm going to make sure that their thyroid is also midline and that there are no masses. You do this from behind. So you push over. Okay. And then I'm going to want to assess lymph nodes. Open and close. Then you also check for clicking in the jaw.